A trip to the hospital is, of course, meant to get you well again. But best of all is when you're healthy enough to avoid it in the first place. A very significant proportion of hospitalisations in Australia are avoidable if people receive appropriate care in the community. The costs, both personally and in taxpayers' dollars, are enormous, not to mention that hospitals are dangerous places if you don't need to be there. So predicting someone's risk of going to hospital is important, but has been elusive. The Department of Health has been trialling a hospitalisation risk algorithm in a small number of general practices, and now the calculator is set to be rolled out more widely. One of the people involved in this research is Professor Michael Georgieff, founder of Precedence Healthcare, an Australian digital health technology company. Welcome to the Health Report, Michael.
Hi.
So what is this algorithm? Just tell us how it works.
Right, so it's quite simple, really. The algorithm is a smart program that connects to the typical systems that run in a GP practice, that when you go to a GP, the GP types in your health information. This program connects to that record of your health, and then based on the data that
it sucks out data.
Sucks out the data from your health record, based on the data that it gets.
So this is the medical software that your doctor is recording the information into?
Yeah, so when you go to your practice, the doctor records your information, whether you've got
the same software that triggers whether you need a cervical cancer screen or something like that.
Yeah, what your pathology, it takes your blood pressure, etc. So it uses that data to then predict, based on what medications you've got, based on what illnesses you have, to predict your likelihood of going to hospital in the next 12 months.
Now, your interest for many years has been people with what's called chronic disease. In other words, you get a diagnosis and you're never going to get better from it. You've got diabetes, you've got heart disease, you've got dementia and so on, and you've been committed to actually helping this. So this is really people with chronic disease, and it's trying to prevent the stepwise downward progression to hospitalisation and eventually to premature death. And if you intervene, if you recognise that you're on the downward slope, intervening to try and keep you on the higher slope.
Yes, exactly. And so the issue here is that, and what's important about this particular algorithm is that it works with the data that your GP has. So this means that your local doctor can, for the first time, be able to tell you, or in fact inform himself or herself, that you've got potentially a high risk of hospitalisation, and knowing that, I, as the doctor, can intervene to
So briefly,
prevent that.
Give us the elements that are in the algorithm. What are they taking out? I mean, for example, if you want to predict your 10-year chances of getting heart disease, it's your dangerous cholesterol level, your blood pressure, whether you smoke, your age and so on. What are the predictors for hospitalisation?
And fundamentally, they're all the same. I mean, they're what medications you're on, they're the types of medications, they're what sorts of chronic disease you have, whether you have diabetes, whether you have asthma, whether you had cardiovascular disease, whether you smoke or not, whether you drink alcohol. So it's all those.
So it's
parameters.
Multiple things brought together.
Yeah.
And how accurate is it in predicting whether or not you're going to go to hospital? And over what time period?
Yeah, so all we can say is as accurate as any other algorithm that...
well, that's not really telling me much. Of 100 people scoring high on your algorithm, how many are going to be in hospital in 10 minutes?
On the 95% confidence level, it's accurate to 95%. So it may get 5% that are wrong. So when it says you've got a high chance of going to hospital, 5% of those may be wrong.
Does it give the GP an action plan saying if you correct this, this is going to prevent, or does it say this is something you need to look at more closely because their chance of going to hospital in the next 3 months is high?
It's a red flag. So the important thing is GPs, particularly with chronic disease, overwhelming forcing them to manage a large number of patients in a longitudinal way is really overwhelming. So there's very hard for a GP to keep track of.
So one of the things that could happen here is that the GP over relies on the algorithm, and if there's no red flag, they think, I can relax about Mrs. Jones in front of me, even though she looks dreadful, because the algorithm's not showing that she's heading for hospital. It's going to miss, no algorithm is perfect, it's going to miss some people who tomorrow will end up in an ambulance.
Yes, absolutely. So I think it's I doubt that GPs, any intelligent GP would do that, because they know so it's more of a red flag that is going to alert the GP to a potential issue that they may have missed because they're so busy looking at attending something.
Now, you studied this in something called the healthcare home, which has been an experiment by the Commonwealth Government and 200 general practices to see if you could actually wrap such people with chronic illness around with care, comprehensive care. Did it make any difference? Did they manage to avoid hospitalizations? I think it's been tested in about 2 million people so far. Did they manage to avoid hospitalization in people?
So those trials are very early stage. So the answer is we don't know yet. I mean, what we do know is that, as you began the conversation, currently we have over 700,000 people go to hospital unnecessarily. We've got...
And something's got to be done about it.
Yeah, we've got 3 million bed days that are preventable. 10% of hospitalisations preventable. And
just in case they think this is a commercial conversation, this algorithm is going to be made publicly available for other people to use.
Yeah, so one of the things that the Commonwealth has done is to make this algorithm available to anyone to use.
Michael, thanks very much indeed. Michael Georgiev is founder of Precedence Healthcare and adjunct professor at Monash University in Melbourne. I'm Norman Swan. This has been The Health Report. Do join me next week.